Good afternoon, everybody, and welcome to BITC's Work Well Peer Learning Program webinar. We're delighted that we have American Express here today to talk about their Healthy Living Program, a multi-country case study for wellness. We've got an absolutely fantastic turnout in terms of delegates for this webinar. There's nearly 60 of you, and we're expecting some challenging questions at the end. Anyway, I'd like to first of all introduce myself. My name's Louise Aston, and I'm BITC's Director for our Work Well campaign, and I'll be moderating the questions at the end. So, in terms of what American Express are going to talk about, first of all, we're going to meet the panel. We're then going to hear from Breckon Jones about American Express's multi-country case study for wellness. Sarah is going to be talking about UK healthy women, or you can actually verbalize them, so that's up to you. So this afternoon we have Breckon Jones, who's Director of Healthy Living, EMEA and Canada at American Express. Breckon is also a member of BITC's Work Well leadership team. We have Sarah Perkins, UK Healthy Living Program Manager at Amex, and Sarah is a member of BITC's Work Well practitioner team. And finally, we have Duncan Jones, American Express Account Director from Nuffield Health. So Breckon's background, Breckon, as I said, is the Director of Healthy Living for American Express's Global Employee Wellness Program, with responsibility for Europe, Middle East, Africa and Canada. Breckon joined American Express from Unilever. We have an ex-colleague who's joined us from Unilever at the webinar today, where he held the role of Employee Health and Wellness Manager, pioneering an award-winning program model for workplace health enhancement and culture change. He's previously worked with major blue-chip companies in the Asia-Pacific region as a corporate wellness consultant, designing and developing health and wellness initiatives. Breckon lives in London and cycles to work most days. I don't know what happens on the other days, but anyway. Our next presenter is Sarah Perkins, who's UK Healthy Living Program Manager at Amex. Sarah is the UK Healthy Living Manager. As I said, her role involves managing the implementation of initiatives to improve the health and well-being of the UK employee population and engaging stakeholders to ensure that this is effectively rolled out. Sarah joined Amex from a consulting capacity in healthcare communications and most recently in social marketing. And her background is in health promotion and nutrition, and she holds a Master's of Public Health from Deakin University, Australia. So I forgot to ask Breckon and Sarah to say hello, so you really know they're here. Breckon, would you like to say hello?
Hello, everyone.
Hi, everyone. Sarah here.
Thanks for that. And finally, we have Duncan Jones, Amex Account Director, Nuffield Health. Duncan has 16 years experience in corporate wellbeing. He's account manager of 15 corporate accounts, so obviously with a lot of experience, and he holds a BSci Sports Science and Health Studies. Is that right?
That's correct, BSc, yes. So, hi, everyone.
Okay. So we're going to start the presentation with Breckon, who's going to talk about the American Express Healthy Living Program, a multi-country case study for wellness. Thank you, Breckon.
Thanks, Louise, and hello again, everyone. Thank you so much for spending the next 45 minutes with us and allowing us the opportunity to share with you our case study for our wellness program, which we call Healthy Living. And what I'm going to do in the 15 minutes that I have to speak is tell you a little bit more about American Express as a company to set the scene for the type of institution that we are, and then focus in on the area which I'm sure you're more interested in, which is our global vision and our objectives for our wellness provision. And then zoom in a little bit from global to my regional remit, which is EMEA, and talk about our strategy there for introducing this wellness program to multiple countries in the region. And then going to throw to Sarah, who's going to talk about our UK program, which is one of our more developed programs. And then Duncan is going to talk to you a little bit about the challenge that we put to not only Nuffield but our other health service vendors to demonstrate to us the way that they collaborate not only with us but also with each other to provide the sorts of services that we require for our wellness program. And along the way, hopefully I'll share with you some of our innovations, some of the challenges that we've faced, and also some of the hurdles that we've had to overcome, because I'm sure listening to our program is interesting, but more interesting for you is probably how you can avoid some of the pitfalls that we might have fallen into along the way. And before I get into the slides, I wanted to just share with you that I make no excuses up front for the fact that we have no real results to share with you. And that's not because we're withholding any results. It's because our program is such a fledgling program that we actually don't have any yet. But what we do have is a fairly robust strategy in place. And we've been recognized already for the strategy and the journey that we plan on taking. And hopefully in time with this strategy and with this action plan, we will be able to demonstrate some real tangible results and tangible returns. So let me share with you first American Express as a company. Now, Amex is a very well-known brand, but most people think that our company is a credit card company. In actual fact, we're more of a services company. And our mission is to work hard every day to make American Express the world's most respected service brand. So there are lots of different parts to our business, not just the credit card business. We have a credit and a charge card business. We have lots of alternative types of payment products that we offer to consumers. These are things like online payment mechanisms, things like traveller's checks, this sort of thing. We provide services to businesses as well as individuals, both small business and large corporations as well. I'm sure many of you, actually been seeing the names of some of you that are on the call today, many of you will have Amex as one of your customers. We also provide network services for merchants, and a very, very big part of our business, which many people don't know about, is our corporate and consumer travel business. It actually accounts for a very big chunk of our revenue. And then we have our merchant services as well and our insurance services. So we are actually quite a diverse company in terms of our different lines of business. We have, we're a Fortune 100 company. We're actually currently ranked 20th in Fortune's America's Most Admired Companies. And last month we celebrated our 161st birthday. So we've been around for quite a while. And we have 87.9 million cards in force and an annual revenue of almost 25 billion US dollars. We have 620 billion US in annual purchasing volumes. That's the amount of transactions that goes through our cards and our payment services. And we have 58,500 employees, and our headcount stretches across 40 countries. And the EMEA region and Canada, which I'm responsible for, is our largest and probably our most complex in terms of different languages and different types of people that we have working for us. So I'm going to share with you a little bit more about our demographics when we come to that in a couple of slides. So let me tell you about our wellness program, our global healthy living program. And in 2009, with the help of Mercer, and I think we have some friends from Mercer on the phone with us today, we sat down and developed our strategy globally for bringing a consistent and yet a diverse wellness program to multiple countries around the world. And in doing so, we came up with our global healthy living mission and some global objectives, all of which we're striving for in the different countries that we activate this program in. So our global mission is to use healthy living as a way to create a better way of life at American Express. And we do this through a shared commitment to wellness, shared between our employees and our partners and the business. And we say that together we'll become a stronger and a healthier community. So we wanted to have that community element in our focus as well, so that it wasn't just about employees, but our reach could extend out into people's homes, and it could extend out into the communities in which we operate as well. That's our mission. And then drilling down from the mission, we have 4 key objectives that we strive for globally and also locally when we activate the program in each country. And we actually rank these according to how much importance we place on them. And probably had we have done this maybe 4 or 5 years ago, the order would have been different. But when we first started to work up this tiering of importance, we decided that number one would have to be that our focus is to encourage employees to own their personal health. So really this is about people, and all of the services and the activities and the initiatives that we do within the program have to be for the benefit of our people and to motivate people, encourage people to be intrinsically motivated to take action to sustain or improve their health. Then the second one is about creating a culture of wellness. This is about the spaces that we create for people to work in. It's about the way that we encourage people to work together. It's about the language and the vernacular that we use when we're communicating healthy living. It's all about the way that we shape our culture towards health and wellness. And then our third objective is to build employee advocacy. Now, we spent a couple of years through the financial crisis taking away from employees, and healthy living is one of those ways that we can give back to employees. So we're really trying to build a connection between the brand of American Express and our employee experience through this Festival of Healthy Living. And then the fourth on the list, which is an important one but still ranked fourth in our focus area, is to contain and reduce healthcare costs. And our healthcare costs are different in different countries, but it is a focus that we know we need to strive for, and it's one of our key metrics as well that I'll tell you about in a second. So essentially our global objectives are focusing us towards achieving a tangible link between good health and better engagement and good performance. And so there are 5 areas there that you can see on the screen, which are our global focus areas. And so whilst we do things differently in each country and in each region because of the cultural nuances and the resources we have, we still have these 5 areas that we are doing consistently across multiple markets. So our marketing and communication strategy is such that our look and feel for healthy living is the same in different countries. So we have the same colour palettes, we have the same core elements of the program, we have the same logo, although in different countries that logo is written in different languages. So in Mexico, healthy living is Viva Santamente, and in Sweden it's Sundlivsdal, or words to that effect. But it does look and feel the same, so that as people travel between different countries and between different offices, they see that this is part of the one thing. We have some interactive elements that we try to make as similar as possible and that we activate at similar times. So yesterday was World No Tobacco Day, and in the USA, the UK, Argentina, India, Singapore, Mexico, Canada, Sweden and Australia, simultaneously we had activities taking place to raise awareness about the benefits of living a smoke-free life or a tobacco-free life. And we promoted our smoking cessation services for our employees and also for their families and people that live with them in a consistent manner at the same time. So in that way we have a multi-market activity. Then we have a global steering committee, of which I'm part, which are responsible for the direction and the strategic activities that we take. And we have some global initiatives where we use our economy of scale and our purchasing power to get a good deal and a good service. So these are things like our global EAP program, which we're introducing this year to all of our countries, and an online health risk assessment tool, which we're also introducing to multiple markets. And then one that I'm sure you're quite interested in and to know more about is our global metrics and measures. And these are the ways that we work towards demonstrating a return on the investment that our different country leaders make in the program. And we have some global seed money that we use to start the program up, but the way that our wellness provision takes place is that each of the country's executive team funds the ongoing healthy living program. So in order to show them a solid business case, we need to have some robust metrics and measures. And globally, we've broken those down into a couple of key areas which we focus on. So for us, they're around utilization, and that's how many people are making use of the different services that we have on offer, how many people are taking place and how often, and how many touch points on average we have per person. Then the other one is around engagement. And this is not only engagement in a in a traditional sense in terms of how employees feel about American Express and how engaged they are in the work that they do. It's also about how well the outside world engages with American Express. So, for example, the types of activities like we're doing today, or the types of awards that we win, or the types of press interest that we receive, all of these things we regard as the way that the world engages with American Express because of the work we do around health and wellness. Then we have metrics which are around population health risk. So we're looking at aggregate and anonymous risk data to help us to inform the way that we shape our program going forward, but also with paying very close adherence to data protection laws in each of our countries, giving people ways that they can track and monitor and improve their personal health time after time as we continue the program going forward. Then we look at our healthcare costs as well, where we can. That's easier in some countries than in others. And also we have a final metric, which is an internal metric. And this is the way that our different country programs adhere to what we would call our American Express best practice for healthy living. So between all of those things, we hope that the way that we've designed our metrics dashboard will be able to start to show us a solid and a consistent return on our investment. So let me just zoom in a little bit to the regional responsibility that I have and share with you the challenge, which if you're working for a multinational company and you're responsible for health and wellness, you probably have some of these challenges as well. All these bubbles that you see are the different countries that we have, and the number is the head count in the country. So we have a lot of people, about 14,000, spread out across 21 markets, speaking 17 different languages, and probably about 1 million HR projects going on at any given time. So there is quite a lot of challenge and nuance that we need to take account of when we're introducing these programs. And what we found in talking to the different country reps that we partner with to bring this stuff to life is that they're very used to receiving an instruction or a template from our US business to say, okay, here's the HR project, make it happen in your country. And what we've done is we've flipped it around a little bit with our approach for healthy living, and we've gone to the countries first and we've said, we have this framework, we want you to flesh it out, and we want you to contribute, knowing the cultural nuances and the things that will resonate better for you in your country, and help us to design the program, and we'll support you to do it, which is quite different to what they're used to. But we've had some success so far. And this next slide is just to share with you where we've activated our program thus far. So the UK, and Sarah's going to talk to you about that in a moment, our biggest market outside of the US, we've had the program going there for about a year, and we've already got some good results in our UK provision. We're still evolving the program there, so there's a bit of work to come. Sweden, where we've been doing work, we're at a point now where we're planning for a big launch event in the next couple of months. And not only are we going to launch in Sweden, but we're also going to do a Nordic program as well, so a lighter version of our program for Norway, Denmark and Finland. And then in the pipeline we've started our due diligence work as well to bring the Netherlands online this year, and Italy will be a fast follower into next year. And then the other countries there we have on our list will go live from next year onwards until such a point in time where we have most of our countries with a big headcount onto our global program, and then the smaller countries onto a lighter version of the program. So let me share quickly with you our strategy in EMEA. Given that you've just seen the different challenges that we have, the reason that some of those are green, some of them are yellow, and some are yet to have a colour is because we have this approach of doing a needs analysis and a wellness audit to see what we currently have in place and where we need to introduce the program and what it looks like. And there is no wrong wellness program. A lot of our countries already have health activities taking place. And what we knew we had to do is communicate a message to the markets to say, because we have a small global team and because our resources are limited, we want to assess the markets one by one and have a linear approach to how we introduce the program. And therefore we needed a favourability weighting. Then we needed to seek out business input as well, because we never know what activities might be taking place, and we always have to be cautious of making sure that if we're going to focus attention on a particular country, that country is the right one for us to be devoting energy and attention to. And then we have these strategic ongoing conversations with the market to make sure that a decision that was maybe made 6 months ago is still relevant. And whilst we might be focusing on some markets, we also need to keep the other markets warm. So things like our global EAP provision and our governance of benefits, health benefits across the region, help us to keep connected with all of those different countries on an ongoing basis. And then to share with you this next slide, this is our activation process in action. So once we had made the choices of the markets to focus on, and we started our implementation work, we knew that we had to have some evidence for what we were doing. So we went through a phase of data extraction and analysis to help us to inform our decision making. And at the same time, we were seeking stakeholder buy-in. So we wanted to sell the program conceptually to our leaders before we told them about what it was going to cost and how they would get the return. So it was a two-tailed conversation to get that leader buy-in. Then we worked on our strategic development, and this is where we had the program design input coming from the various markets. And this is where we have both facilitated that journey internally, but also used our partners like Mercer to help with that work. And then also we moved from there to our true implementation planning and our launch event. And Healthy Living is very much about increasing awareness initially, and that's what the launch is there to do. And the launch looks different in different countries. But more importantly is the ongoing Healthy Living program. So whilst the launch is great to activate awareness, it's more about what the program looks like day after day, month after month, and year after year. And so to share with you an example of what one of our developed programs looks like, Sarah, who is in my team, our UK Healthy Living Program Manager, she's going to talk to you a little about what our program looks like when we zoom into a country. So I'll turn over to Sarah for the next few minutes.
Thanks, Breckon. So today I'm going to be speaking to you about the UK experience, as Breckon mentioned, and I guess focusing on some of the key milestones and key programs that we've got going at the moment. So I'll kick off just with the first slide, which I just want to talk to you about the integrated model of wellness. So I've only been at American Express for the past 4 weeks, and the biggest thing that is that's been my task for the next couple of months is the integration and the implementation of the new vendors. The idea of bringing on these new vendors, as Breckon said, was from a global perspective, and also ensuring that these people who are providing these provisions are seen as the best in class. So everything that is provided is the best service we could possibly give to the end user, our employees. So when we brought some of these people on, it has been somewhat of a challenge, but I think Duncan will speak more about that shortly. And the idea behind having these different people involved was to ensure that there's complete integration and that there's a seamless knit between all the different service providers. I guess from a business perspective, this ensured that there was absolute the integration between proactive and reactive options. So we've got things like the reactive aspects such as occupational health, attendance management, private GP, and then simultaneously running alongside the proactive aspects such as the fitness programs, the health assessments, the coaching and the physiotherapy. And what we noticed that from this integrated model of wellness is that it does align quite nicely with the BITC model, just in terms of the synergies and the realities and being flexible in terms of the workplace stressors that everyone faces. So while this implementation of all the new vendors was taking place, at the same time we also were continuing on with the UK program, which you can see from the slide here. It explains the different aspects that we're taking on. So each theme is split into a quarter. So you'll see there Q1 is a nutrition theme, Q2 move more, Q3 heart health, and Q4 resilience. So at the same time as communicating these messages and focusing on these key 4 aspects, we also have initiatives that are running simultaneously. Now, when I first arrived at American Express, I was presented with this plan, and I understand Breckon loved the plan of attack. So this is one way we can keep on the straight and narrow and make sure there's no way of missing out any of these key milestones. So some of the initiatives that that we've been doing throughout the year, you can read there as far as the GDAs and the vending machines, and also the Brighton Marathon, which I'll speak about shortly. But I guess the biggest key milestone we've got for this year is to roll out these health checks, which will begin at the start of Q3. And I guess, as Breckon says, we don't really have any key metrics to measure against at the moment in terms of population health. But this way, once we kick off these health checks, this will be a way that we can continue to progress the program and, I guess, build on it year after year and make sure that everything we provide and deliver is absolutely bang on what our employees need and want. So that's the key thing. As far as the actual activities in action, here are just some of the examples. So the actual UK program launched in February 2010, and so far we've had some really fantastic success. So while the focus has been on, improving the health and well-being of our employees, I guess, as Breckon mentioned, it's also about integrating what happens at work in terms of wellness to also at home, so making sure there's a real community aspect and it's not just kind of a nice to have at work, it's a holistic approach that we have. So some of the key events here, we had, as I mentioned, the launch, and then we also had the Brighton Marathon, which this year was the second year that American Express was involved. And we had up to 100 Amex employees actually competing, and an estimated 150 to 200 employee volunteers on a day, which is absolutely brilliant given that it did take place on a Saturday in extreme heat and an early start for everyone, and some people coming from out of Brighton to take part in the volunteering. So in this way, it's a really nice way to really engage people outside of the workforce and understand that it's wellness and community good is not just something you can leave at the office. So in terms of some of the metrics, as Breckon mentioned, one of these metrics is about external recognition, and here you can see that there are certain clips and bits and pieces that American Express has been involved with. So although it's great to have Amex's name next to some of these really positive pieces of media coverage and also in terms of public speaking opportunities, it's also great to make sure that the actual agenda of work well and healthy living is on the radar in terms of the more mainstream aspect. It's not just confined to HR-related areas. So that's kind of the key aspects that we've been dealing with so far, and continuing the program as it keeps evolving later this year and beyond. So I'm going to hand over to Duncan now, who's going to talk about what it was like collaborating with American Express and some of the other vendors as well.
Okay, thanks Sarah, and hello again everybody. Just obviously explain what I'm going to focus on now is that I'm going to explain what Amex have asked us as vendor to provide to support their metrics and measures part of their global focus. As Breckon and Sarah have both said, that we're looking, they've asked to explain that we're offering a first-class service, and it's going to be a reactive and also proactive wellbeing service. So in terms of that, we're going to provide a kind of more reactive service by the way of physiotherapy. So if someone presents themselves an injury, we're providing them with a service at two of their key locations in Brighton and Burgess Hill. But in addition to that, staff will be able to focus their physiotherapy support by using our network as well. So they'll get a consistent delivery of service from a physiotherapy offering. In terms of that, they'll also access the service via their line managers. So there'll be a direct referral into our services from their line manager. So there's a kind of a gatekeeping opportunity to ensure that they're referring for work-related and work-aggravated conditions. But also they'll be able to access our service through their private medical insurance, in this case which is Aviva, and they'll be going through a warm handover to our contact centre to actually have the service, which is a great way of ensuring a seamless solution for their employees. As far as the more proactive service is concerned, the physio will be providing some service from a proactive point of view by way of education and support, but also will be providing fitness services, which are the classes and also the on-site fitness and wellbeing centre, which is due to open in Q2 next year. So there's going to be a great proactive opportunity to support their staff that way. But also on top of that, the health checks, as we've mentioned, is something we're providing, which in a nutshell is a 30-minute assessment, which involves usual measurements like the body mass index, height and weight, weight-hip ratio, cholesterol measurements, blood sugar measurements, and also blood pressure. But within that, there is a coaching element to this. So once they've had the assessment, they'll be given some advice via a physiologist who will provide them with information to help them make behavioural change and improve their well-being, and give them some guidance to make an improvement. From that, we might identify someone who is more of a high-risk individual that may need to be seen by their GP, and that will be passed on. But if they need to be seen again by a physiologist, they will be seen probably after about 6 weeks to ensure they actually are on the right road to recovery or are being developed in the right way to improve their health. In terms of other services, as I mentioned, there will be the physiotherapy providing the education, and the support that we'll be offering in terms of the theme days is also key to ensure that we are supporting and raising awareness of the healthy living brand within the business. Moving on to the integrated wellbeing side of things, it's very important that we do integrate well, and that might be via the way of occupational health and actually receiving referrals for physiotherapy, but also the physiotherapist might want to refer back to occupational health for further support, whether it's a workstation assessment or something along those lines. But also the physiologist will be referring into the online health risk assessment as well, which will actually be helping ensuring the data is collected to provide the Amex with information that will be very useful for them. Moving on to the working with others, which is a real key area for this program to be successful. Nuffield will be working with other vendors, and we need to ensure we do capitalise on our strengths and as providers to ensure that we are going to give them the best possible service. And the key for this is to share the same common goal and have open dialogue at all times to ensure that we are meeting the requirements of the individual and also providing the service which is required. And if we are always working like that, I think we'll provide them Amex with a great service. Also moving on to agreeing service levels and targets, I think with all these programs it's very important to ensure that we have some agreed and measurable guidelines and service level agreements, and we are going to be targeted to ensure that we provide a large amount of health checks within the locations within Amex, and we're looking to do about 2,000 health checks within 10 months, which is going to be a challenge. But that will provide Amex with the information they need to then focus their strategy going forward in terms of location or a particular demographic that might need more support to improve the well-being of their employees. The also key part from the physiotherapy offering is to make sure there's early intervention with physiotherapy, and to do that obviously we need to make sure the on-site physios are delivering the service, have the availability, but also with the wider network, people can be seen very, very quickly to ensure that their injury is dealt with before the condition gets worse, but also to show that the employee has given access to these services in a very sort of speedy way. Moving on to the management information reporting. Data is key for a lot of these initiatives that we're providing, and the data will be provided on a monthly and quarterly basis, and the meetings that will take place that Sarah will lead and Breckon will be supportive as well is to ensure that we are delivering against our measurables, but also providing data that we can address things as they come up and ensure that we are actually taking on board challenges that we might face as the program is evolving. And the MI that we are providing is going to be consolidated with one of the vendors. So the idea is that we'll be providing the data to a central point, which will be consolidated in an overall report for Amex, which I think is a great way of ensuring that it's all tied together, and we'll be working together to produce a consolidated report to give information back to the client, in this case Amex, and with recommendations. And it's all good giving data, but you also need to provide the recommendations and interventions that will support that as well. Branding is also an area, so co-branded marketing and with Healthy Living. As Breckon mentioned, the Healthy Living brand is going to be a brand that's going to drive the program in all countries, but also it's a brand that employees will need to recognise as soon as they see it. So it's important that as vendors we are working with that brand, and we are going to co-brand in lots of cases to help demonstrate that Amex are engaging with specialist organisations to provide the service, and with the co-branding it does help with raising awareness as well, we believe, to ensure we touch as many people as possible. Moving on to the last point on my slide is in terms of intervention, support and consultancy. With this one, as I mentioned earlier regarding the management information, it's important that we do work on the next steps, what next. So we'll be providing after 10 months a lot of data to actually suggest what we can do to move the Healthy Living program forward, and we need to actually look at ways of using that data to the advantage of the program to keep it going, but also to provide the directors of the business the information they need to support the program going forward, as Breckon mentioned earlier. And the whole point of this is obviously to help support the business, build the employee advocacy, and also empower the individuals to meet their own health objectives, and obviously to reduce costs as well. So if we can provide that, I think the program will be a great success.
Thank you very much, Duncan, and thank you to Breckon and Sarah for a really interesting and comprehensive presentation. We now have the opportunity to take questions. Would anybody like to ask a question from our panel? Well, while you're thinking about it, I'd like to, what really strikes me about the American Express program is how much focus there is on the wider community. And I'd like to hear more about your plans moving forward, Breckon.
Yeah, it's one of our key focus areas in multiple countries, but let me use the UK as an example because we're in the UK at the moment. So Sarah was talking about our involvement with the Brighton Marathon, which is a big community activity. Amex sits on the Sussex Leadership Council group, which is responsible for lots of different health activities in that Sussex region. And because we have such a big office and we employ a lot of people from the local area down in Brighton, we think that we have a social responsibility to do as much as we can for not only our people that live in the area, but the other people that are associated with our employees, or maybe the merchants that are in that area. And it's not just Sussex, but we thought that the Brighton Marathon would be a great way of us associating ourselves with a community activity. And rather than us just throw money at the marathon and say, well, we're going to sponsor it, we decided that we would sponsor all of the activities that were to do with volunteering. So we would encourage our own employees, as well as their friends and families, to volunteer for the marathon. And then we would also support all of the activities that took place in the community to engage the 2,000 extra volunteers that they needed. So that's one big community focus that we have in the UK. The other one is a fantastic opportunity for us, and that's our association with the Amex Community Stadium in Brighton and Hove. So we sponsor the stadium. It's the football stadium, and through that sponsorship we have a great opportunity to extend our reach into the local community and do all sorts of different community activities with the Brighton and Hove Albion in the community group, which is the charitable arm of the stadium. So we have a plan in place now where Healthy Living will collaborate with our community group so that all of the volunteering activities that we do, well, not all, but as many as possible, have some association with that Albion in the community group. So, for example, in a couple of weeks' time, Sarah and I and our wider compensation and benefits team, which is the team that we're part of, as well as other members of HR, we're all going to a couple of local schools in the area, and we're volunteering our time for the day to teach kids about 5 a day, about nutrition information. And then after that, we're going back to the Brighton Stadium to do some team building activities and debrief on the things that we've learned. So, you know, it's one of those things where we try as best we can to pair up our health messages with our community messages. And I know there's a lot more that we can do in this area, but, you know, I think as a small example, those two things are great ways that we extend our reach into the community.
Yeah, thank you very much, Breckon, for that. It sounds very exciting. We now have a few questions. This is from Tina Herndon. Is your EAP and HRA with the language requirements?
Yeah, I think you need to scroll up a little bit.
Sorry. Okay, start again. Were you able to find one provider for your EAP and HRA with the language requirements that needed?
Do you want me to answer
question
that
for Breckon.
Yeah.
Whilst you talked about the metrics, you would...
It's a separate question.
Yeah. Sorry.
So, thanks for the question, Tina. The simple answer is yes. So our EAP provider is PPCW, PPC Worldwide, and we have a global agreement with them to provide the EAP service in all of the countries that we operate in. And the way that they provide that service is that they have multiple language capabilities through the partnerships with local companies in each of the countries. So, for example, in Germany, they have a company that they partner with called Carente to provide that EAP service to us. But our agreement is with PPCW for a global EAP, so all of the reports that we receive are from PPCW. And they don't have all of the language requirements that we want, but they have pretty much all of them. The online HRA, the vendor that we use there is a company called Infotech, and they have multiple language requirements as well. And in the languages where we don't have a translation, we're working with Infotech to build that translation out. So, yes, we do, is the answer to that one.
Thanks a lot, Breckon. Okay, we have another question that's specifically for Breckon from Matthew Thomas. Whilst you talked about metrics you would use to measure progress, what do you think success looks like? Are you looking for a reduction in absence, target in terms of greater employee happiness, etc.? Interesting question.
Yeah, it's a good question, Matthew. Hi, haven't seen you for a while. The measures of success for us. So I guess if I put myself a year from now, looking back, in the first year of our program in multiple markets, we don't want to overstretch ourselves in terms of what we're striving for. So whilst absenteeism is one of the metrics that we look at, absence levels, we haven't said we're going to reduce absence by X% in 1 year or 2 years' time. Similarly, where we have engagement questions in our Global Pulse and in our online health risk assessment, we haven't targeted specifically in these early stages to say we are going to increase engagement by 20%. That will come in time as we develop our strategy further. But you know, the things that we are looking at is trying to address absence where we can get data. So, you know, it's easy in some parts of the business and easier in some countries where it's a legislative requirement that we do track absence. But in other countries it's a lot harder. And that's why we're introducing things like the attendance management system in the UK, so we can get a better grip on what the cost of absence is and what the level of absence is. Engagement questions there, we've worked with universities, we've worked with our partners to come up with some consistent engagement questions that we can ask to people that we know through benchmark data are correlated to health metrics as well. And then, you know, similarly, the other area I was talking about, population health risk. So we haven't targeted ourselves to say we are going to reduce our hypertension risk by 10% in the next 12 months. But what we have said is that we will look at the risk factors that we see on aggregate and whether people have modifiable or non-modifiable risk factors, and what we're trying to do is see a change in the number of risk factors that people have so that their overall risk is decreased. So it's a work in progress, and as I say, we didn't want to limit ourselves or overcommit ourselves by picking specific figures. But I think if I look back in a year's time and we've gone some way to addressing the areas where we see higher levels than what we would like, then that would be a good measure of success from my point of view.
Okay, that's great. Thank you. Right, we're going to take a couple more questions. Simon from Bupa, thank you very much for your question. Hi, I'm interested in understanding more about what participation looks like and how you've appealed to those individuals who are difficult to convert. Maybe Duncan, you'd like to comment on this?
Yeah, I can. Hi, Simon. Yeah, just in terms of this one, it is a good question because I think participation and engagement, it comes here, is we've got to obviously try to get to everybody, and we've got to use the kind of the marketing process to try and get everybody to come along. And I think anyone who may be almost in that well mindset will probably come along with no problems, but those people that may need it most might need a bit more convincing. So it's a case of using sort of case studies and people who have had that experience to spread the word of mouth. And I think we'll do things around the lines of speech bubbles with people who've had the experience and try and get people to relate to what they're going through regarding the health checks is concerned. And I think that will really help snowball the success of the programme, really.
Thank you. Sarah, do you have any thoughts?
Yeah, I guess from a communications audience perspective, I guess it is making sure that whatever communication channels you use are targeting kind of different people. So, for example, in our World Services team, so the call centres, they're constantly on the phones and are not really the type of people who are going to sit back and flick through rounds and rounds of email updates and things like that. So making sure that our communication channels are targeted and using things like post-it notes and posters on walls and things like that to make sure that we are looking after everyone.
Thank you. Final thoughts, Breckon?
Yeah, I was just going to say, when Sarah showed the example of our UK program, that calendar of events that we have, there's actually more in our Healthy Living program than you saw on that screen. And the reason that we make these programs quite diverse and have a lot of variety is because we know that people are at different stages of readiness to change. And so it might be that a poster on a bathroom wall is one of the things that switches somebody on and gets them to take action. Or it might be some kind of technological innovation or a piece of kit that we can give to people that switches them on. But you want to have a broad and a program that has a lot of variety in it, so that despite where people are in that spectrum of readiness to change, there's something in your program that can engage them and switch them on.
That's great. Well, thank you once again, American Express, for a great presentation and for taking such diverse questions. Thank you to our delegates. Just to let you know is that we will shortly be launching our brand new BITC Work Well peer learning program, which will consist of a number of workshops and more webinars. So watch this space.